Hi guys, my name's Lilly Sabri. I'm a chartered physiotherapist and today we're going to be running through some exercises for recovery after knee replacement. Now it's so important with these that you seek advice from your surgeon. So whoever you had your surgery with would have given you very specific guidelines for normally a period of up to 12 weeks post-surgery. If you've had physiotherapy since then, make sure that you're liaising with your physiotherapist on what your exact protocol is. So you're going to sit in your chair. Now, depending on how supple the knee is after the surgery, you may need to do an active assisted knee extension. So to start off with, you're going to engage the quad muscles and attempt to straighten the leg out, keeping the foot flexed. It's perfectly understandable that for some of you, you may not be able to get into full extension. From there, you're going to bring yourself back as far as you feel possible. Now, for most of you, you may need to do this active assisted, which means you're going to use the other leg to help you. So you're going to hook the other leg behind, and then from there, you're going to use the power of the good knee to try and straighten out the bad knee as much as possible. From there, slowly lower back down, allowing gravity to assist you, and then into flexion if you need a helping hand as well. You can go a little bit further, active assisted. Now it's normal to feel a bit of a pull here, guys. I don't want you to overdo it with this. Make sure you're not pushing into pain, but if you are feeling that there's a little bit of discomfort there, it's totally normal because you may have some scar tissue build up.